So back to Freeman. As I kind of thought about that, and I'm sure we've all kind of thought about that a little bit over the last few days. You know, the news camera came on and the news feed came on, and something really caught my head from a first responder role. As I looked at that news camera, I saw police officers from the city of Cheney, city of Spokane, Spokane Valley, a real integrated, collaborative response to the needs of that scene. And as I started to think about our role as a healthcare coalition and the work that the DMCC did in that response to place those patients, I started to think about the coalition. And really, a lot of us weren't there. We didn't have a role in that response when it took place. But I can honestly say that over the course of the last few years working on this effort, these conversations that we share on a regional level with all of our healthcare coalition partners has really framed the way that that response took place. We understood the healthcare system. We understood who could provide what service based on the need that's out there. And we put all of that into play to provide the fastest, most efficient placement of those patients at the appropriate level of care. And I guess the reason I say that is because the coalition effort really relies on input from all of you. And even though you may not see a direct role, your feedback and your input to the conversation really makes those whole conversation for a really collaborative response. And so I really thank you for being here, because the work that we're doing really does include all of us. It involves all of us. And I really hope to God that we don't come to a point when we all have to respond at the same time, because that will be big. But that's what we're working for. We want to know our partners. We want to know what they bring to the table, and we want to know how to integrate them into the response. And all of us being at the same table at the same time is what's going to get us there. So thank you for taking the time to be here today. One more button. So just a few ground rules here for today. Just to make everybody aware, the emergency exits to our facility, great facility provided by Honduras. You've got the main entryway that you came in. We've got two side exits on both sides of the room. If we have to leave the room for any reason, let's meet over here at the north side of the building in the parking lot. It frees the north side, the north lot or the east lot here for any responders that might be attending. Let's meet out there, make sure we've got the building cleared. Let's sign out before we leave the facility so that we know who's no longer here. Speaking of signing out, hopefully you signed in. We have a sign-in sheet that's being circulated around the room. If you haven't signed in, it's very helpful for us to know who all's here. Gives you an opportunity to provide your contact information, your email address as well, so that we can communicate with you. We do have a Wi-Fi password in the facility if you need Wi-Fi access. It's Honduras, as you see on your screen. Food and drink are allowed in the facility, so feel free if you have it tucked hidden in your bag, feel free to use that if you need it. We would appreciate if your cell phones are silenced so that we can continue the meeting without too many interruptions. Bathroom locations are, as you know, right out the door. Women's on the right-hand side, men's on the left-hand side, depending on which way you're facing. But very easy. We do not schedule a break in our agenda because we have a very limited time. So feel free to get up, move around the room as you see fit or as you need for your comfort. We also have, last I saw, about 20 people on GoToMeeting, I think, which is a great opportunity to bring regional partners to us so that they don't have to travel. So what that does entail, if you're a presenter, is if somebody asks a question from the audience, we will try to take them a remote microphone, but if we can't get it to them in time, please repeat the question so that those on GoToMeeting understand the answer that you're giving. It really helps them understand the conversation. If you are out on GoToMeeting, you have a chat function on your computer screen. So if you have questions, comments, please enter those in the chat function. We'll be monitoring that throughout the meeting today to keep in touch with you. We've covered the sign-in sheet, presentations, meeting records. Those will all be able to be found at our srhd.org/HCC website, which is the location you can go to view and have access to all the plans, policies, guidance documents, and general information that the Healthcare Coalition provides. So before I get to this slide, what I want to do real quick is just say, we're going to talk about a lot of things that we do, but I want to let you know who does it, who does it, because it's really exciting that now we started out 15 years ago, whatever, with me and a group of volunteers. At one point, I don't know how many years ago, we were able to hire Erica, who you will be hearing from later today, who really changed the way we did business because we had somebody that really was able to do the business. Erica moved on to bigger and better things, and we transitioned to Travis. And so Travis continued that work, but because of some transitions that we'll hear about today, we're able to have more people here that work on your behalf to do the coalition work. And so what I'll do is I'm just going to give their names, and just maybe they can stand up, get familiar with their faces, and understand what their roles are, because they're a resource to you. So obviously you all know Travis, I'm assuming, or if you don't, you will at some point. Travis is our coalition coordinator. Carolyn Cartwright is with us about 2 months now, I think. And she is our communications coordinator, does a lot of our communication work. Casey, who you will be hearing from later today in the back of the room, is our Region 9 training and exercise coordinator. We also have the opportunity through the Department of Health to have some multi-regional positions that are focused, that are housed here in Spokane, but are actually doing regional work throughout Eastern Washington. And you'll probably see from and hear from and work with them as well. So I'll have them stand up. Heidi Wilson is our, geez, she just made me do a presentation. She's a regional training and exercise coordinator. Marin Murphy, this one's really cool because I talked to her on the phone a couple of times 2 months ago, and I've not had the opportunity to meet her yet. So this is really cool. Welcome. And then Hannah, I think we've all heard from Hannah today or in the past. She is our technology IT info systems person that does a lot of training around the WATTRAC, secures applications that we use. So those are the regional staff positions and the local Region 9 staff positions that we have. So get familiar with them, understand their roles, and see how they can help you out. So just a couple of opportunities. I mentioned WATTRAC. We talk about WATTRAC a lot. A lot of you are on WATTRAC. Some of you may not have heard of it. WATTRAC is a web-based system supported by the Department of Health that provides healthcare system information, including bed capacities for hospitals, services that are open for hospitals, hospitals that might be closed, and a whole gamut of other information that WATTRAC provides. It also provides some information when we get into our DMCC role that we'll talk about later. We have two opportunities coming up for those of you that want to get familiar with WATTRAC or do not have access to WATTRAC yet. On October 18th, we have a WATTRAC training that's going to be hosted by Kootenai Health. So that is one opportunity. Got the information there on that opportunity. November 17th, we also have an opportunity at Tri-State Memorial Hospital to learn to get registered, to understand and trained on the system. Two opportunities. Those informations are both in our newsletters. They're on our website. And if you have any questions about that or are interested, grab any one of us on the way out today and we'll get you connected. So today, we're going to spend some time, we're going to hear from Chandra Fox, who is the Deputy Director of Emergency Management for Greater Spokane Emergency Management. She's going to start our meeting off. And then we're going to take some time to hear from Erica from the state perspective around emergency preparedness. A lot of things that are going on the state level, and she's here to fill us in on that information. And then we're going to hear about our Disaster Medical Coordination Center activities. Part of their role is to keep us informed about what they're doing, how they're doing it, and how it impacts us. So they're here to give us an annual report of the activities that they have been involved in, the improvements in the system that they have made, so we all understand how that system works. At that point, we're going to switch gears a little bit and hear from Travis, and he's going to give the annual report for the Healthcare Coalition, and he's going to talk about all the work that we've been working on, and I think it's pretty phenomenal to see the things that have been taking place. Then we're going to spend a little bit of time talking about the Healthcare Coalition exercises that we're working on, 3 sub-regional exercises that will be there for our regional healthcare partners. Casey will run us through that process and help us understand that exercise opportunity. Then we're going to split into our facilitated work group by provider type. It's something that we started a few meetings ago to bring our healthcare partners together by provider type, primarily around the CMS rule, so that we can share ideas and share information about how our partner agencies are moving forward with the CMS requirements. Today we're going to focus those conversations a little bit more around exercises so that we can all gain from the knowledge that we're all sharing.